the frontal bone of the skull tends to be where you hit your head. If you run into something, you know, you duck a little bit and it hits that eminence. There is a supraorbital ridge here, and this arrow is actually pointing to the supraorbital ridge of the eye, of the orbit of the eye. The superciliary ridge is just a little above it. It's just where your eyebrow rests. So it's a little bit superior to the orbit of the eye. Let's see, I think I can do something here with drawing on it. Okay, so superciliary is more up here, and there's superciliary. Okay, and then the supraorbital ridge is the superior ridge of the whole orbit of the eye. The glabella is a prominence that is, let's see if we can do some different colors. Right here, that's glabella, and it's a prominence between, right between the eyes here, a little bit superior here to this portion of your nose, but it's right here in the middle between your superciliary ridges, actually. So that's glabella. It tends to be more prominent in men than it is in women, and people have different levels of prominence of this ridge. Is that okay, everybody? You got that all right? Okay, let's scroll down. All right, let's erase them. Clear all drawings. Okay, so here I am. One day I had this accident in private practice. Oops. And what I did was I tripped over the sensor wire. I didn't have it behind my foot when I was taking an x-ray on a patient, and I ran out of the operatory because I have a little distance to go because it's on the other side of my doorway. And I tripped over that cord and fell right into some cabinetry. And there was this big bruise right here on my head. That's where your frontal eminence is. Okay, so I went, oh, I got to get a picture of that. I wish I'd gotten it sooner when it was a bigger bruise and brighter, but that's where it is. Okay, in the cheek region, I had to put some sunglasses on this student's picture. But anyway, so there's different regions here. There's that buccal fat pad. It's just this pad of fat tissue here in the cheek region. It gives your cheeks fullness. And this student had beautiful cheeks. So you see that buccal fat pad here. As we get older, these kind of follow the flow of gravity and they droop a little bit. All right, and they'll sag down into the lower jaw and create the jowls you see on elderly patients. Another region that's very important is the TMJ. And the TMJ is back here. We're going to look at that further in the skull document. The TMJ is something you're going to check out every time you see your patients. It's part of the oral exam, which you are learning now. There's the zygomatic bone. I'll put the green under the TMJ. There's the zygomatic bone, and I'm going to find a different color. Let's make that red. Here's your zygomatic bone. That's your cheekbone. And the arch. I'm going to try this right. Here we go. So here is the zygomatic arch here. And we're going to be looking at them further in the skull unit. Oh, here's a great picture of, here is your superciliary ridge here. The superciliary ridge. Here is, that's a superciliary. I'm going to write super ridge just so right here. I'm sorry, super, all right, ciliary. I'll do glabella in a different color because it kind of is prominent on this picture. And there is the glabella. You see that prominence right there? That's glabella. I got that okay? Go back to my mouse. Now another item, another anatomic landmark that you're going to find and palpate on your patients is the masseter muscle, and it's in this region of this of the human cheek, which you see, right in this region. And you see it here highlighted in pink on the visible human if I remove the skin and tissues and other muscles of the head and neck. Right here, this, the top of it originates on the zygomatic arch of the skull. And we'll look at that again, like I said, further in detail in the skull unit. We'll look at that very carefully. All right, so the ramus, or the mandible, has a number of landmarks, okay? One region is the ramus, and let me draw that in. The ramus is this portion of the mandible. Okay, so that's the ramus. Actually, it goes up a little higher than I drew there, doesn't it? Yeah, right up to here. Sorry. But it's that vertical portion of the jaw. The body I have kind of outlined here in, in these purple boxes, but the body is the whole region of the mandible that's horizontal. So it comes from each side and it goes all the way around the front of the jaw to the other side. And so that's the entire body. So the one here in dots is on the other side of the skull, and this one here with the solid lines is on the side of the skull facing you, but they do continue across the front of the jaw. The angle of the mandible is shown here in green L's. That is where the ramus meets the body of the jaw. And that's the angle of the mandible. You would feel it down here on the side of your face. And that's the angle of the mandible. Any questions? Okay. Mental protuberance is this prominent region of the chin. And Jay Leno here has quite an extensive mental protuberance. His chin is quite pronounced here. So the mental protuberance is this region of the jaw and chin, part that sticks out. In the neck region, we have a pretty prominent muscle here called the sternocleidomastoid muscle. And you see it here highlighted on the visible human in pink. And here you see it extending on the student as she looks up at, let's draw here, okay, at another student. So I'm not sure if this is going to draw. Yeah, it is. Here you go. So it's right here on this student. And it's coming from just behind the ear on this process of the skull down into the sternum and clavicle region. So sterno, here is your sternum. Oh, I got a line, not a pen. Okay, cleido, I'll do that in a different color. Here is the clavicle, so the cleido part. And mastoid, which is the third part of the name, refers to this process up here. So I have the sternum in an orange line down here. The clavicle here extends all the way across to the shoulder, of course, but you see that the muscle comes down and attaches here as well, and then up here at the mastoid process of the skull. That's the sternocleidomastoid muscle. And you palpate the lymph nodes all along that muscle, having your patient turn from side to side. Okay, everybody? Okay, now we get into a little more complexity in the throat here. The Adam's apple. Adam's apple is this protrusion of the thyroid cartilage to which the arrow is pointing. The purple is the thyroid cartilage here, and that region that protrudes right up here is what produces the Adam's apple. And it protects the inner structures of the neck, the vocal cords, the larynx, and it also helps create the tone of our voice. Men have a larger Adam's apple as shown here, and so their voice is louder than women's, or deeper, I guess is the better term for that. Not louder, we all can get loud, but my husband would probably argue with me about that, but it gives them a deeper voice than women. Okay, so the larynx does contain, here is the larynx on this image. It does contain the vocal cords, it produces our sound. There's also protection of the trachea in this region, which goes into the lungs and protects, us from inhaling food particles into our lungs. The thyroid gland is this butterfly-shaped gland, as you see here on the lower right. And it is just below that thyroid cartilage, or just below the Adam's apple. So when I palpate a neck and I feel that prominence, then I know I go just below it to palpate the thyroid gland. And it is the thyroid gland is this dark structure here in you see it inferior to the thyroid cartilage here. A lot of people have to have their thyroid removed, and what you will see here is a scar that is right at the neckline, the base of the neck on the patient. So this patient allowed me to take a picture of the scar that resulted from the removal of her thyroid gland. That just gives you an indication too of where that gland is in the region of the neck. The eye is something we're going to look at in our patients as well. It's important. Can tell you some things, right? The orbit is the bony socket, which we'll be looking at further. The sclera is the white of the eye. The palpebrae are the eyelids, right here, upper and lower. And then the canthi are the medial canthus is toward the nose. The lateral canthus is, the outside corner of the eye. So these canthi are important regions for you to know. You will look at particularly the lateral canthus in some of your X-ray procedures. It helps me line up the X-ray machine. So the lateral canthus is particularly important. So let's review. I know you had this in your anatomy class, but let's just review the parts of the eye. There is the cornea. It's shown here in this lateral image. Okay, the cornea here, and that covers your iris and pupil. And you also see the cornea. Let me find my drawing again. Down here, covering the iris and pupil of the eye in this diagram. The lens is indicated here. No, that's iris. There's the lens is located behind the cornea. And it is a spherical structure that helps to focus light into the eye. And here you see it right here. I should do a different color. And that's your lens. Let me underline cornea in case you're taking notes here. Let me change the color of the cornea. Oh, I'm sorry, the lens. Make the lens red. It's this object right here behind the cornea and pupil here. Okay. The iris, then, you know the iris as that part that colors the eye. It expands and contracts to let in light to the eye, depending on whether it's dark or, here's the iris here. Not the best color to pick, was it? Down here. So that's your iris there. Gets larger in the dark to let more light in, and or it makes the pupil larger so to let more light into the eye, or it narrows to when there's too much light or it's bright sunlight, your pupil will narrow. This is the part that makes it difficult walking out of a movie theater on a bright sunny Sunday afternoon, because your iris has been dilated to let in more light, and as soon as you step out onto the sidewalk, you're in the sunlight and you're like, because there's too much light coming in. Your iris contracts and then your eye is more comfortable. The pupil then is the dark center of the eye. You all know that. Again, that opens and closes based on this, the diaphragm, the iris. The conjunctiva is the mucous membrane that lines the visible part of the eye and the inner surfaces of the eyelids. So the conjunctiva, let's get a different color. Let's do pink. All right, is going to covers this part of the eye, and it also then curls up and covers the insides of the eyelids. Okay, so if you fold up your eyelid and you turn it inside out, which is not comfortable, you see the conjunctiva, the mucous membrane of the eye. It's kind of like the labial mucosa. When I was a kid, and I spent a lot of time outside riding my bikes and stuff, and when the evening came and the gnats came out, if I would get a bug in my eye, I was afraid it would get into my brain. I didn't know anything about the conjunctiva that would prevent that. But I did have that fear, I'm going to tell you. It's crazy. Conjunctiva is what gets inflamed when you have pink eye. So it was pretty appropriate to color that pink, right? Now, the cataract is something your patients may tell you they have. They have that you're going to have cataract surgery. And what that is then is opacity that occurs in this lens of the eye. And so here you see the pupil is dark. Here they've highlighted this, lens clouded by a cataract in this image to give you an idea of, what's going on when somebody says, I have cataracts, and they're going to have surgery to so they can see better. A very common procedure, right? I think we probably have all knows people who've had cataract surgery. I've just been informed that I have some developing, so I see that in my future when I can't see so well. I remember telling my mother, she said, I can't wait till I can see better. And I said, well, Mom, just giving you a heads up. You're going to see better when you look in the mirror too. So those wrinkles are going to show up as better too. Because that wasn't very, very nice, but I just wanted to prepare her. I was just making fun of her, actually. So that's the eye. The ear, the external flap, that whole flap is the auricle of the ear. Okay, so we got the elephant here with a big giant ears. So I thought that was pretty appropriate. You guys know a lot about ear anatomy in your generation because of piercings that are done. Some of you may have a pierced tragus. So here is the tragus, this cartilage piece right here. The antitragus is opposite the tragus. So it is this cartilage right here. Everybody knows the earlobe. Its lobule is the really particular medical term for it, I guess, but we shorten it up in our conversation, calling it the ear lobe. And then the outer rim of the ear is the helix. It's this edge that comes around the outside of the ear down to the lobe. Okay, so some people have the helix pierced as well. So you see a helix piercing here and up here as well. The nose. There you go. There's a nose for you. Okay, so what are some landmarks of the nose? One is nasion. And this is a landmark on skeletal radiographs that are taken for orthodontic treatment planning. Okay, so that's the nasion. It's a bony suture. It is not soft tissue. Okay, and it occurs between your frontal bone here above, oops, me and this mouse, we do not get along, F for frontal, and the nasal bones here and here. The nasal septum, it divides the nasal cavity into two parts. Oh dear, I gotta learn this one day here, right? All right, so the nasal septum is formed by your ethmoid bone up here. There's a vertical plate of your ethmoid bone here in this region, and then the vomer is the inferior portion of the nasal septum when you look at the skull from this view. So there is the vomer portion. If you look at the back of the skull, it's all formed by the vomer. But from the anterior region, the superior portion of the septum is formed by the ethmoid bone, and the inferior portion is from the vomer. As it comes forward, the vomer is shaped like a wedge. So this is anterior in the bone, and this is the posterior region is much wider. Okay with that, everybody? All right.
He says it's wider, the vomer?
The vomer is taller. It's wedge shaped as it goes posteriorly in the head. Yeah. So let me, I should have said taller really. Let me go back to my pencil drawing. So if I was to take this bone further back, here and here, it would, in the back of the head or back of the nasal cavity, it's like this. Okay. And getting ready to sneeze just thinking about all this. Excuse me. Then the ethmoid is wider in the or taller in the anterior region, and it becomes a point back here in the posterior skull. So there's your ethmoid. And this whole connection forms the bony septum of the nose. When people say I have a deviated septum, they have a deviation in the shape of this bone. Okay, so the next feature is the root of the nose, and that is this region right here, okay? That's the root of the nose. It's right between the eyes. Oh, I want to stamp on a draw. Okay, so if the patient has a lesion on the root of the nose, everybody knows it's going to be right there somewhere. All right, it's not nasion. Nasion is the bony suture in this region. This is the root of the nose. So if I point to this area on a test and I'm showing you the skin of the face, it's the root of the nose. I'd have to use a skull image to point to the nasion. Is everybody clear about that?
Yes.
Okay, everybody hear it, right? Okay. The bridge of the nose, this cute dog. You can tell I love dogs. Okay.
Picture.
Isn't he beautiful? One of the instructors in the Allied Health Department years ago had dachshunds, and she sent me this picture. So here is the bridge of the nose, okay? It's where your eyeglasses sit, okay? It's right here. It's formed by those two nasal bones we looked at earlier, right there. The root of the nose is superior to the bridge. It's up here, and my squiggly got a little out of control. I apologize. Get to a different color. Let's make it blue. I haven't used this color yet, so let's try this one. So here's the root of the nose up here. Okay. Not too bad, right? Okay, so let's clear all drawings and a couple other regions of the nose, and we'll be all done with this one, all right? The ala is the outer cartilage of the nostrils, and you all know the ala because people have ala piercings as well, right? So the ala, let me get that. No. Is here. It is an important region. You need to know that because, again, it's used in anatomy, not in anatomy. It's an anatomical feature used to in radiology. You're often using the ala and the tragus as a landmark to position the head. We want a line from the tragus to the ala parallel to the floor. So our patient's head is not down this way that way, which can alter our radiographic image. We got to have the ala tragus line parallel to the floor. So you're going to be using that term. The nares are the nostrils. So, you know, if your mother other said, "Get your finger out of your nares," that's what she was talking about, which I'm sure she did not, but get your finger out of your nose. But she means get it out of the nares, out of the nares. Okay, those are the nares. The columella is that vertical soft tissue here in the nose, divides it right here, the columella, beautiful columella. And the horse, of course, has a columella like you've never seen before. There's the columella, it's right there. If we get a little tickle of our nose, we might just delicately itch the columella. Okay, right behind that is cartilage to the septum of the nose, but that's the columella. So that's the pink mark. And then the apex is the tip of the nose, just like it's the tip of a triangle or any other structure that we look at. And the apex is the tip of the nose. There you go. Where the point is, the soft tissue point here above the columella. Okay, any questions about the nose?
The apex would be the rounded, like kind of.
Right there. Yeah.
All right.
There's my columella. Right there. I can't see if you see me okay, but
yeah,
I think we're cool with that. Yeah. Okay, so here's the columella.
Mm-hmm.
Apex. It's just above the columella.
Got you.
Yeah. Good. So just some external landmarks. So let's go into the skull, and I have that here on this computer. Let me get to that. Any other questions, guys? Okay, let me go to another. Oh, here it is, it's in here. And I'll have to reshare my screen probably, but that is okay.